Hi, good morning, folks. This is Coffee with Community Services. Today is April 25th, 2025. My name is John Decker, the Director of Community Services at Alta California Regional Center. Thank you for joining us this morning. We've got 53 folks on so far. We'll go through introductions of staff and then we will get into our agenda for the day. So good morning from our Community Services Department. I see Alejandra on and Christine and Marty. Good morning. And also our lead Jason is on, as well as Ethan and Jaslyn. I see Yvette and Tom on, and Christy and Carly and Michael from Community Services as well. From Client Services, I see Dana. Good morning, Dana, Client Services Manager. And our manager Jordan is on, and our housing specialist Rhonda is on. And good morning to Denise and Beverly and Jessica as well from Community Services. And of course, my assistant Zach and Damien too. Good morning. We are going to have our sign of the week and Deaf Culture 101. And then, Emmanuel, I think we'll jump right over to you for our vendor spotlight after that. So I am going to spotlight Michael for his portion of our agenda.
Good morning. For this week's sign of the week, I have three for you. We have what, who, where. They're fairly simple for today. Are we ready? We're going to start with what. What? Like this. It's pretty easy. What? And make sure you have your facial expression indicating with your eyebrows furrowed that you want information. Raise your shoulders up a little bit. For what? So then we're going to use our dominant hand, put it in the L hand shape, bring that thumb to your chin, and then you're going to wiggle that index finger for who. 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 Yes. And then we have where. That's pretty easy. You just wave your finger like this. Where? 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 Again, we'll do all three. What? Who? Where? Simple. All right. Great job, everyone. I will go ahead and put the link in the chat if you would like more practice or if you would like to look back at previous sign of the week. All right. Now for Deaf Culture 101, I'm sure many hearing folks have a similar question. How do I learn ASL? How is this something I can pick up? So I have a few tips for those who want to learn ASL a bit faster. First, practice just a little bit every day. There's a few ASL apps that are similar to other language apps, such as Duolingo. That is for speaking different languages. However, they do have some ASL apps. There are two available that are very popular right now. The first one is Lingvano. That's Lingvano. They have ASL in English Sign and BSL, British Sign Language. They also have Australian Sign Language. So three options there, but I do encourage you to go ahead and check out ASL on that one. I'll post a link for that as well. We also have the other app called ASL Bloom, Bloom. They're very cool apps, both of them are. I do have them both. They do offer a free trial. So if you want to go ahead and check it out, then decide to go ahead and pay for it. What's involved in these apps is grammar, there's games, and different ways and resources that I really do encourage you to download and check it out. And it can help you with your everyday practice bit by bit. And I'll send you the link for both of those. I highly encourage you, especially if you're a bit nervous about meeting deaf people, go ahead and download either one of those apps. They are available for you to use and practice with. So, secondly, another tip for picking up ASL a bit faster would be to socialize with deaf people, chat with deaf people. It would be like if you're trying to learn how to swim, you can't do it without water, right? The same thing applies to learning ASL. You have to hang out with deaf people. Thirdly, you can follow some deaf content creators on social media. There are deaf influencers. They have content in ASL depicting everyday situations, and that also includes information about deaf culture. Fourthly, ask for feedback. So suppose you're practicing and you feel like you have been practicing with a video or you looked at a video online, but you were struggling with identifying or using a sign, you can ask a deaf or hard of hearing person for help, and they are more than happy to help you out there. Fifth, don't give up. Keep on keeping on. It doesn't matter if you're making mistakes, that's how we learn. And deaf people will recognize and appreciate your uh, learning to sign. And so now I am going to show a quick PowerPoint for the emergency and safety signs. All right, can everybody see my screen here?
Looks good.
So I've developed this that to make for deaf folks in an emergency situation. And I know that in Deaf Culture 101, we talked about picking up a few signs. This is something that you can print with a total of 15 words as it relates to different emergency situations. This is available as a PDF for you to download and print and post. There's also a QR code that will take you directly to the YouTube videos for how to see each sign or how to produce each sign. So you can use that on your phone or tablet. Go ahead and use that QR code that will take you directly to that YouTube video. And here's an example of what that looks like. This is the sign for fire. So in a picture with it just being still, you can only see the hand shape, but not quite the movement. So here, being able to directly go to the video, you can see the movement along with the hand shape. So fairly simple, and the video will just repeat over and over. That's a benefit for your program, for any deaf and hard of hearing you may serve, and for nonverbal folks. So you can begin to use sign language and, in order to interact during those emergency situations. I will go ahead and post that link in the chat as well. All right, I think we have it.
Excellent. Thank you very much, Michael, as always. All right, I think I'm going to jump over to Empower Academy now, and then we're going to get into some rate study discussion and some regional center updates. Empower Academy, take it away.
All right. Thank you very much. I really appreciate the time and for you guys all listening in. That was also some really great information. I'm gonna definitely be posting that around my facility. But my name's Emmanuel Jackson. I am the director of Empower Academy. So Empower Academy is a fairly new vendor. And we have two facilities, and I will go into that briefly. But I have been working with adults with developmental disabilities for close to 14 years now. And in those 14 years, I've gained a lot of experience with supporting these kind of individuals and what works. And it's kind of always been a challenge to support everybody's needs. So I'm going to definitely go over the individuals that we serve at Empower Academy as well. But Empower Academy, our mission is to assist with adults with developmental disabilities through compassionate support and self-advocacy, and provide engaging programs and experiences that will enhance their well-being. And our vision is to create an inclusive environment where individuals achieve their personal goals, gain independence, and feel a sense of belonging. Um, I have a slideshow that I am going to be putting up. Just one second, let me start sharing my screen. Okay. And then I will also be making it. Okay. All right. So here is, once it loads, the Empower Academy slide. So this is actually our Mac Road facility on the right, and let's see. So our locations, we have one in Mac Road in Sacramento, and then we also have one in El Dorado Hills. I hear that there's a big need for programs within that area, and so we're trying to do our best to support the areas that need that have a need the most. And we do plan on expanding and building out more locations and more facilities as we go. Our program hours are roughly between 8 to 2. We do accept full-time and part-time participants as well. And our entrance criteria and kind of the individuals that we would be serving would be the 18 with a diploma, 22 years without a diploma. And the support staff would be 1-to-4 ratio as well. So for every 4 participants, there will be 1 staff present, and each location is outfitted to support 90 participants at each location. And with that, the 90, we do have room to support non-ambulatory individuals as well. So some of our core programming areas would be life skills development, vocational training, community integration, arts and expression, functional education, as well as just physical exercise and multimedia components. So we've been adding multimedia components because of, as the years progress, a lot of people are more interested in learning things about how to, let's say, make podcasts, make YouTube videos, and also a lot of social media awareness, because a lot of our participants are very, very famous on social media. So we like to go over like the privacy acts and stuff, and try and just keep them aware of the challenges that social media does provide. We do offer Zoom classes as well. So if individuals aren't able to make it in on certain days, we do offer that Zooming portion. And once again, we do offer part-time and full-time. So for community integration, we do have multiple vehicles on site. So we have a couple of vans that we're going to be taking to go on outings, and those outings, the main point of that is to kind of access and to socialize and find professional opportunities for these individuals to kind of join the community and just have a sense of belonging within the community. We also offer tailored day services. The tailored day services are personalized support. We are really big on personalized support because not all jobs and not all tasks would fit everybody's needs and goals and interests. For myself, I need to have a job that I love for me to enjoy it, stay committed, and to progress. So finding those personalized supports and areas that we can best place people is really important for our Taylor Day services and really important for Empower Academy. Um, and then with the Taylor Day services, it is a lot more of a flexible scheduling, and it can operate outside of our traditional programming hours as well. So this is the El Dorado Hills facility on the right, and Jessica Carroll is our president, and there is the contact information for that, and there's my contact information as well for Mac Road, and we are always open to tours, even if it is the regional workers, if you guys ever want to come by and check out our facilities, we would love to have you. We're really excited to show off these facilities because once again, they are brand new and we have a lot of areas to support. And if you guys have any input on areas that we could provide more assistance or add additional components that may pique individuals' interests, then we would love to hear that feedback as well. Um, and yeah, we once again, here are some more pictures of our facility, and our contact information is within this PowerPoint, and I'll be trying to see if there's a way I can send it out to you guys to get those contacts information. But if you guys have any referrals, we will be accepting the IPPs, of course, Cedars, and then from there we would love to schedule tours to meet any individuals that have interest in our locations. But thank you guys so much for your time. If you guys have any questions or concerns, feel free to ask and reach out.
Awesome. Thank you so much for that presentation. It's, excellent to be able to spotlight newer service providers and especially a service provider that has 14 years of experience, right? And so, excellent. Maybe just your email address, if you could just drop that in the chat for now, just if folks do want to reach out to you directly, they have questions. We did have a number of additional client services managers that have joined the meeting as well, and they are always interested in learning about new services that are available for referrals. All right. Thank you. And a reminder, if you are interested in being spotlighted, please reach out to us. You can reach out to Jason and we can get that set up for you as well. I've been gone for the last couple weeks, so I just want to acknowledge and thank staff for keeping up our weekly service provider meeting. I heard that we had some very well attended sessions while I was gone. I was at the statewide Association of Regional Center Agencies Community Services Directors meeting 2 weeks ago. And then last week I was at the California Community Living Network conference presenting about our assistive technology pilot that we are doing. And so happy to be back here. I am told there was approximately 130 more folks that were logged in for our discussion about the HCBS grants. And I see Marty is on here, so that, of course, that means I can call on people when they're on camera. I saw a picture of you all looking at all of the grant submissions. Do we have a number of how many came in? Or do we know approximately how many, Marty?
Yes, we had 78 proposals come in.
Do you know how that compares to previous years, Marty?
That's a good question. I know it wasn't as many as that, maybe 50 at the most, maybe ish last year. This was an unprecedented amount.
Excellent. Well, this is what we were hoping for. We were hoping that folks would really think about, how they would like to utilize these funds to really come into compliance with the HCBS, final rule and be able to provide I think a lot of these things, more individualized supports for clients, more opportunities, more choices. And so really looking forward to seeing how we, dig through all of these proposals. And that's why we've got some, great HCBS staff that get assigned to these. So, sorry, I forget the deadline. When are we submitting to DDS? Do you remember, Marty?
Yeah, so we just had the deadline to receive the proposals last Friday. So we'll be going through them in the next couple weeks. Our deadline to submit our selected proposals will be May 9th, that Friday. So we have a very short timeline this year.
Excellent. Well, thank you. And I guess in advance, as you guys continue to work very hard on this, I appreciate all of that hard work and thoughtfulness as we look at awarding almost $900,000 worth of funds through this opportunity. And again, and I'll talk a little bit about some of the federal level stuff, but our ability to have access to these, special pot of HCBS funds, just like any other funding, is really a year to year type of situation. And so very pleased to see that our service providers have showed up with all of these great proposals. All right. And so with that, I am going to share a little bit of information. So I did mention that I was at the California Community Living Network annual conference, and I don't know if you guys can see my shared screen there, but some folks you guys may recognize there. You see some folks from the STEP agency, Des and Jay, obviously Austin. These are some folks from East Bay Innovations that co-presented with us as well. I will say I always appreciate the opportunity to be able to share all of the amazing work that our service providers are doing. And we won't do it in this meeting quite yet, but I did have an opportunity to share some videos yesterday with my staff of some of the individuals that are utilizing the assistive technology, and hearing the stories about people that have never had free time on their own and being now able to have some remote monitoring and not having staff with them all the time and getting a little bit more freedom has been just one of many really exciting outcomes that we've been seeing through the pilot that we are doing for assistive technology. We certainly are looking forward to doing some additional vendorizations that are related to this. Rhonda is finishing up right now a vendorization for Grand Care, which is a tablet that can be used to communicate for people and help control assistive technology. So we need to do some continuing education here. Need to talk with our service providers. Definitely need to work with our client services managers and our service coordinators so that folks understand how assistive technology can be so beneficial in opening up opportunities for people. We've been very lucky because throughout the whole pilot, we've had Max Robertson, one of our client services managers, that participates in our monthly meetings. So we have someone at our regional center that really understands like how the individuals are assessed for assistive technology, and then also how it aligns with how we purchase like independent living services and supported living services for people too. So I'm very encouraged because a lot of folks are very interested in the opportunities expanding for assistive technology for regional center clients. There's been a lot of advances in the aging world around utilizing assistive technology through places like the independent resource centers, but I think we're looking forward to a further expansion for that as well. Additionally, while I was there at the California Community Living Network conference, I was able to listen to a presentation by the new director of the Department of Developmental Services, Pete Cervinka, and also presentations by Aaron Carruthers from the State Council on Developmental Disabilities. In the presentation by Director Cervinka, he talked about the current situation as it relates to Medicaid funding and the level of concern that does exist for potential cuts to Medicaid as it relates to developmental services in the state of California. He reminded the audience that a third of the services that are funded in the state of California are funded through Medicaid. And I appreciated Aaron Carruthers also shared from the State Council that 46% of Californians receive some type of Medicaid benefits. And so that really kind of puts into focus how broad and how direct the impact can be if there is cuts related to Medicaid. I appreciated the opportunity to represent our regional center. We had a management meeting, and so we were not able to send a number of folks over there, but there was the Rally to Save Medicaid that occurred on April 23rd, and I saw a number of youth service providers out there. This was out in Rockland at the offices of Congressman Kevin Kiley, organized by a number of different groups, primarily Disability Voices United, the Association of Regional Center Agencies, and the California Community Living Network, CDSA. There was a number of folks that were out there that are part of the different groups. Excellent to see so many clients, so many family members out there. This is the crew from Sierra College Life Program that were out there. Some of you know Jackie from our board as well, who was out there with us as well. And the chair of our Provider Advisory Committee, Lindsay Daiba, out there too. So I was, again, was very pleased to be able to participate. I know there was quite a few family members and regional center clients that were happy to see a regional center person there in my Alta California shirt. So again, this is a vital concern to our community, and Regional Center will share with our community opportunities to participate in any additional advocacy that may come forward. All right, and again, just want to acknowledge all of you service providers that were there and supported clients to be able to participate in that as well. All right, I'm going to share my screen with the Department of Developmental Services website, and I want to share something that just got posted, I believe, and it's relatively new. And I know this is another kind of issue that is on people's minds, and it's related to privacy and information about developmental disabilities and how that information, can be shared. This looks like it's been written relatively recently, though it's not dated, but it does say Pete Cervinka's name on here. January. Oh, it was in January. So just wanted to note that the department did put this on their website, on the front page. So if you are having questions from people related to how their private information is going to be shared, some of you are aware that we support everyone that is residing in California, including undocumented individuals as well, through the regional center and our services and supports. So just again wanted to show folks where those resources are on DDS's website. All right, I want to now touch on some rate reform stuff, if that's okay, for just a few minutes, just to give some updates on information and then also some activities that are going on at the regional center to try to best support service providers. So I think about 3 weeks ago, I shared the directive that came from the department on April 1st of 2025. It was 24 days ago. And in that directive, there was some new information that was shared. And some of that new information was that they were extending the deadline to get into the service provider directory for those service providers that haven't done it. But additionally in there, they also shared that if you are not in the service provider directory by that end of May date, that your billing will be cut off by the regional centers. Well, I didn't say by the regional centers, but that your billing will be cut off, which I would assume must be done by us. And so with that, we've had some additional lists that have been provided to us by the Department of Developmental Services. They have the service provider directory. There's a lot of people that are in here, but about 40% of the providers that are on this list are people that have not completed all of the activities that are required within the service provider directory. So again, they may be on this QIP eligible list, but they haven't completed all of those activities. And I think we had around, and Jordan, we have to try to remember this, around 270 or so, I believe, that were on that list. And we had another list of about 260 vendors that have active billing right now, but are not part of the service provider directory, meaning they haven't even like connected at all. The concern is we know that we have a number of usual and customary service providers. We know we have a number of SMA or Medi-Cal rate service providers, but also just a lot of care homes and other providers that have had no contact whatsoever with the service provider directory. And again, the area of concern related to that is previously we had been told we could kind of find vendors in non-compliance if they had not gotten into the service provider directory, but now there is the new directive that specifically says not being able to bill for people that have not gotten in there. How we are addressing this at our agency is that we have the lists of all the different service providers, and we are now going to start, in essence, doing like robocalling utilizing the Everbridge system. So that's one of the additional outreach activities that we are doing is we're just going to keep calling to the numbers that we have until we can get some type of response back from some of the service providers. It is imperative to us that we have our providers be able to bill. We do not want any lapses in billing because that immediately hits cash flow on service providers and it can lead to an immediate interruption in services in some cases as well, which we have seen. And so that is our now we have some very solid lists of people that the department has given us, and so we are going to be doing a lot of direct outreach just between now and the end of next month to try to get every individual qualified into the service provider directory, and then those that are in the service provider directory completing all the activities that are required in there. Again, there's been, I know they had the Senate hearings yesterday, and I'm not going to get too deep into all the discussion of the Senate hearings that went on yesterday for the budget for health or for the Department of Developmental Services, but there certainly was feedback about the challenges that have been faced by service providers in being able to successfully access and update things within the directory. So I don't know if anyone has any questions about that. It's just we, again, now that we have this list and the department has continued to reiterate the importance of ensuring that we get all of the information in there. To that end, what you'll start seeing from us is kind of some targeted messaging, and I won't go through the whole thing, but you guys should be kind of seeing a little PowerPoint screen. You guys see that there? And so this is a toolkit that the department gave to the regional centers so that we can begin discussing with the remaining providers, and we're incorporating the language that they've given us in the toolkit with the messaging that we're sending out via Everbridge and the continued email messages that we get. It is certainly a challenge, us running down service providers to get this information and make sure that they're in the system is a challenge while we're concurrently trying to vendor all of the applicants that we have within our regional center and then transition many of you still to your new rates within the rate study. So again, lots of activities at our regional center to try to get folks into the compliance here. Any questions about that from our service providers? We'll just continue to update you as there's more, from the department that comes in related to that. All right, I want to share my screen again, and I had an opportunity to go over this with our executive management team and had an opportunity to go over it with our staff yesterday within our community services department. But I think Rhonda is still on. She was on a little bit earlier, but we had an opportunity to be able to submit some applications to, oh, there's Rhonda. Hey, Rhonda, can you tell folks what this is a little bit?
Sure. So these are projects that we have are supporting and partnering with on their application for funding. And so if they do get their funding and their projects come to fruition, we will have set aside units with them. So one we're already partnered with in West Sacramento for 8 units. However, with this particular funding source, if they get awarded, we would be getting an additional 8 units. So that would bring us up to 16. we are partnered with Brettonwood in Davis, so that would give us 10 units. We have one in Placerville, that's 21 units, one in Elk Grove for 31 units, Pleasant Grove and Roseville, great area, 13 units, another one in Elk Grove for 19 units, and a new one in Woodland for also 19 units. So I think the last time that we kind of talked about this, everyone was like, "Oh, yay, awesome. Look at all these set asides. That's great." But just keep in mind, it only happens if they come to fruition. So we partner on a lot of these projects because we're trying to get our foot in the door. And this is a way, an opportunity for us to do that that's not tied to gap funding, that's tied to our services, which we're going to provide anyways. It gets us in the door and gets us those reserves if these projects make it to development.
Thank you. Yes, we have to make it very clear that just because we write a letter of support or we talk about our services and supports, it does not mean that they will be awarded the funding. However, if we don't let support anyone, then we definitely will not have any projects that receive funding. And some of these did score very highly on their self-scoring with the additional support from the regional center. One of the reasons why I wanted to share this, and again, this is not the GAP funding. This is not funding that comes from the Department of Developmental Services. This is through Housing and Community Development, is that our stakeholders, and many of you, represented here, are stakeholders as well, really talk about trying to find options outside of the downtown Sacramento area for housing. And so, Rhonda has been charged with developing and trying to find things up in Placer County, finding things up in El Dorado County, where it can be very challenging to get some of the affordable housing projects up off the ground because of some of the fire insurance challenges that we face. And so I appreciate it, and it's been great to be able to have a number of projects kind of throughout our catchment area. We're certainly looking at trying to get more support for some type of project in the Sutter Yuba area because of that continued growth that's going on up there. But I think we have a HUD 811 project that might be coming to that area. Is that right, Denise? Right? There's one, right? Yeah. And that's Sage Housing too, I believe.
Correct.
Yeah, we should hear. Hopefully we'll hear back soon, but it's in the process.
Excellent. And we share those, just to help me explain that a little bit, Denise. We share those housing units for the HUD 811s with other Medi-Cal. Can you explain the other entity?
Yeah, so the other entity is through the waiver program for elderly, different waiver program than the Medicaid waiver, but we share those vacancies. And so the referral and the priority for those as the priority one, which would be an individual that is currently residing in a Medi-Cal funded facility, such as a state developmental center, IMD, acute care hospital, ICF, a skilled nursing facility. And then the second level priority is individuals who are in jeopardy of being placed into one. And so the other agency that we share the vacancy with, 100% of their clientele are residing in skilled nursing facilities, which puts us in a little bit of a weird position because their clients are always a priority, and it's not first come, first serve. It's if you're a priority one, you get priority over anybody else that's been on the vacancy list because you're actually meeting the requirements of the program. So yeah, so it just takes, I meet weekly with the 811 state team, with the apartment complexes, service coordinators to go over, referrals and to talk about any concerns or anything going on with the placements currently at the apartment complex. So if we have any supported living or SLS, I'm going to be really honest with you, one of the biggest hurdles, the second biggest hurdle we run into, other than the priority one for the other agency, is that our individuals don't have basic information that is required, like a California ID or ability to get their birth certificate, a copy of their benefits awards letter, and an understanding that it is almost like an emergency. If we have an individual that wants that apartment, that application needs to get done. It needs to get done yesterday, and it needs to get over to the apartment complex. We need to get our clients over there for the interview. Things work like that. And our process for our clients, in all honesty, is extremely slow. And so otherwise, and somebody other than our client, if they complete the process, they will get the apartment, even though maybe our client has been on the wait list longer. So first come, first to finish the process. So if anybody has any questions, definitely reach out to me. I'll put my name, telephone number, and email address in the chat box. Definitely reach out for me if you would like me to come and present at your agency. Let me know. We'll talk about this and how we can partner together to make sure that we are providing that opportunity to our clients.
Awesome. Thank you very much. Again, you can kind of tell because we don't necessarily have the set aside the same way as like the gap funding, we don't get like the 100% guarantee that it's going to be our clients that fill those units. However, we still have been able to successfully serve a number of individuals of our, regional center in those units. So, I wanted to touch on one more rate reform thing because I think I hope we have a number of transportation providers that might be on here right now. And I know Damien, their specialist, is on, but I received feedback that some transportation providers received the new rate survey and some transportation providers did not. And these are service code 875 transportation providers. And so I wanted to just see if I could get feedback about if folks did receive it or maybe I misunderstood. I thought it was supposed to go out to everyone. Eric?
So we received it and I reached out to, it's coming from Burns and Associates, not DDS or the regional centers. And I reached out to them because some folks had said they got it, some folks they didn't. So they said they used the provider directory to send out the emails to everybody that was listed as an 875. So obviously a lot of transportation providers are under hold harmless. There's less of that urgency to be in there. So that's likely an incorrect list. And I know some folks that are in the provider directory that didn't get it, so I can't explain it. So I sent it out to a group of folks that I had their emails for. If anybody else needs it, I confirmed that I can forward it on to you to take a look at it. But yeah, they use the provider directory to email blast out that survey.
Okay. And I explained to providers that we have not seen the survey. Like, I don't know what it consists of. But thank you, Eric, because I didn't know that it was shareable. Would you be able to email it to Damien? So if Damien hears from any transportation providers, he can forward it all along as well. Just want to make sure people get the opportunity to be able to give that feedback and to explain. There's I think a couple different right now, different service codes where the department is resurveying service providers related to their costs. And help me if I get this wrong, Eric, but my understanding was this was a more simplified version than what was done during the previous rate study back in like 2018 for recording your costs. And then they were going to be utilizing that data to look at what the new mileage rates would be set up for service providers.
Yes. So many of us probably didn't do the original survey. That was 8 years ago. And that was, I don't know that they got a lot of good data from transportation providers back then. But it is several sheets that is collecting data directly on provider operating costs and how you're running your vehicles today. So that they can, and this is because as advocates, we've been successful in proving to the department satisfaction that the models that they have previously released do not accurately capture all of the provider costs to run a service. So the costs are underestimated, undercalculated, so the rates are too low. So in doing that, we made very specific arguments saying, here's where you made a mistake. Here's where you made a mistake. The number of driver hours versus vehicle miles driven versus the amount of fuel cost per mile and maintenance cost and acquisition cost. So what you'll see in the survey is information by vehicle. So you're reporting on a vehicle in your fleet and what data, what it costs for you to purchase that vehicle, how much maintenance or fuel you spent on that vehicle, how many miles that vehicle drove, how many trips that vehicle had. So you're going to want to take your corporation's data for your regional center only services, and you're going to want to then report that out by vehicle. And it's very important to not underreport you want it to be accurate. But one of the things we want to make sure is because you're reporting it by vehicle, it's kind of easy to kind of miss costs because you didn't, it was allocated differently. And so just that, please make sure that you're looking at 100% of the cost for your regional center of services do get allocated in those right categories, or else they will again undercalculate your costs. So I've already helped some folks with that today, and some others. So I'm happy to talk with anybody else that wants some support. And it's coming to you and Damien right now.
Cool. And maybe Eric, you can just put maybe your email in the chat too, just for anyone that's logged in and is, thank you. Appreciate that. I believe, and I don't know, I don't have Helen on right now, but I believe the early start service providers that they were also talking about a possible resurvey, but I don't, the transportation one was the one that we've been waiting for like 2+ months. So I'm glad that it finally got out, and the next people I hear from, and Damien, the people we hear from, we'll let them know that we can share the link if we get it from Eric here.
Yeah, if I may, John, that
Yeah, go
I
ahead.
did receive a copy of that survey. I just forwarded it to you in the chat, or not in this chat, but in our internal chat. I'll send it to your email as well. But I did receive a copy of it yesterday or the day before,
Good.
because a vendor was asking for advice on how to fill that out. So I've seen it. I just haven't had a chance to go through it completely yet.
I already talked to him.
Oh, good. Good. All right. I think that covered. One last thing that just as it relates to rate reform that is really a big challenge, I think, for us right now is we are now about 4 months into the department saying that they're going to put something in writing that covers some of the additional mileage calculations that are not built into people's rates. I'll give a for example here. If you're a supported living provider, there's a certain amount of mileage that is built into your rates. If you're a respite provider, there's a certain amount of mileage that they've built into the rates. And since like January, they have been saying that there will be a directive that's going to come out that allows us to add some of those additional costs to be able to cover some of the long distances. We have 10 counties there are a lot of rural areas that we serve, and sometimes getting high quality services means that you service providers have to travel a ways, and so I don't know, it's still forthcoming. I don't know if anyone has heard anything else from the department about when that is going to be coming in the future, but that is something that we continue to wait for. And I don't know, it's a challenge because it's really impacting our discussions with service providers that are looking at moving from their previous rates to the new rates, but there's this uncertainty about the mileage aspect of it. We know we can utilize the transitional rates through the end of December, so we're not like we're not up against it like this month or something, but it's just a situation where once we get that clarification from the department, you understand we have to then also train our service coordinators so that they know when it's okay to authorize the additional mileage and things like that. So there's just a number of things we have to operationalize after we get the directive. And again, it's coming up in meetings with service providers when we're talking about doing the transition of their rates. All right. Let's see. Everyone's communicating and getting connected in the chat there related to the transportation part of it. So thank you very much for providing those resources to everyone. And Damien, we could talk more about it next week too, about how we want to make sure we're consistent with our feedback with the providers and making sure that everyone hopefully gets an opportunity to access the survey and get it back into DDS. And Eric, you had not heard anything about what their proposed turnaround time on any of this stuff was, or did you?
It's due May 5th.
May 5th, okay.
In terms of when we could expect
Well,
or new work groups, that I would just say that the only thing we've heard from the department is they were hoping to use the entire whole termless period through July 2026. They felt like they had that whole time to get this right. So I don't think we're expecting anything urgent in the near future.
excellent. If you have issues, questions, concerns related to a number of different things, I always share that I believe utilizing your voices as service providers is extremely valuable to the people in the state. There is upcoming meetings that are going on with the Department of Developmental Services, and some of the things that people will be discussing are the quality incentive programs. I think this is something for you as service providers you definitely would want to be involved in and understanding and giving feedback about. So just wanted to share that information on DDS's calendar. Additionally, on our calendar, I do want to plug that we do have our May 7th community meeting coming up. And you can always find additional Alta activities on our calendar. And I will drop our calendar right into our chat so that if you would like to check that out. And then one of the things that people do ask about is I want to get the MailChimp updates that come out. In order to receive the emails that come out via MailChimp, sign up here on the front page of our website. And when you do, put down that you're a service provider. There's some things that we send out just to you as service providers, and we do it through here. I don't know, as we have the service provider directory getting more robust, and maybe we'll move over to when we have 100% compliance, all of the emails being in there. There's a lot of moving parts as it relates to this right now. We're working on standardized vendorization statewide. I can give folks more updates about that, but that's another thing that's going to be coming here this summer is the new process to do vendorizations. And it's going to include, starting off at DDS and then those vendorizations then getting processed through to the regional centers. So it will be interesting as over the next few months, we kind of operationalize that and take a look at it. Any questions? Standardized vendor. Oh, yep, Eric. Yes, go ahead, please.
Question. I think in a previous forum, you had shared that Alta needed some additional verification or clarification from the department in order to process hold harmless calculations for respite vendors or other vendors that have mileage. Have you guys gotten that clarification that you need? Or is that still an item that needs clarification from the department?
Let me think here. So we had said that we needed more clarification to process or I think we can process the hold harmlesses.
When there's a mileage attached to like an hourly, when you're going from bundling.
Yeah, and that's what I'm saying. Like that is the challenge. We don't want to switch service providers over that have a bunch of mileage attached to it, because then we have mileage built into the new respite rate, and then we have a mileage on top of that, and we don't have a methodology. So it seems like it would make the most sense to keep it where it's at right now, and keep the mileage auth in place too.
Do you need the California Respite Association to get involved in asking for anything?
I just want the directive from the department talking about what we should do if there's additional mileage that's not cooked into the Burns and Associates rates, because that impacts respite, it impacts so many different service codes. If we just got some clear guidance about, you can provide evidence to us if it's above the 250 or whatever it is in the rate study, then it seems like a pretty easy thing for us to calculate. We just need the way to do it.
If you would like to, if you think that there's a role for, say, advocacy organizations, the California Respite Association, to make a request to the department and others that that we see an issue, then I'd be happy to work with you guys on that. Sometimes it helps to come from the provider groups asking for that clarity. So just reach out if that's something of value.
Yeah, again, to us, I feel like that's the biggest area of additional directive that we kind of need right now is that'll help make a lot more conversations with service providers easier when it comes to transitioning them to the new rates, if they know that there's that other way to get paid for the additional mileage.
Okay.
All right. I will say we are working. I just want to acknowledge the hard work that's being done by staff to update procedures right now. We have many procedures that have been written over the years at our regional center that do not align now with the new directives that have come out, and there's new procedural language to help support IPP language with some of these new services. And so I don't think we kept count, but there are dozens at least of procedures that are going to need to get updated within our regional center. And so I just want to, again, acknowledge staff that are working on that as well. many are aware that we have moved to the new IPP DDS IPP template, the standardized IPP template, and also at our regional center, along with many regional centers and some of your agencies, we've had some turnover in staff as well. So staff getting used to a new IPP formats. And so we're really looking forward to providing some additional support from our community services department through our procedures so that our service coordinators have all the tools to have the most effective planning team meetings possible with kind of these new service definitions and everything. So it is certainly a lot of work, and again, acknowledge the staff that are doing that. I hope everyone has a great weekend. Thank you for all the amazing resources that were shared in the chat, a presentation from Empower Academy. And please don't hesitate to reach out to your assigned community services specialist if you have any questions related to all of these letters that are going out from us. I think we've already sent out several hundred letters again, all over again.
Yes.
But this one's going to have the initials of your assigned community services specialist on it, so hopefully we don't have any errors in service code descriptions, but we're doing our best to catch them. So, all right, folks, have a great weekend. We'll look forward to talking to you next week. Take care.